Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon, founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna do something very special and very informative. We're gonna go through a case and go through step by step the evaluation process of the aging changes that exist in one of my patients, as well as really follow each step of the recovery from the first day after to all the way to a year and a half afterwards. And at the end of it, we're gonna listen to my beautiful patient discuss her experience during this period of time, as well as for us to be able to see what somebody looks like a year and a half after full facial rejuvenation. So without further ado, let's break it down. All right, so I'm gonna introduce my beautiful patient, Cheyenne. She's 49 years old when she came out to meet me in San Diego for her vertical restore facial rejuvenation. Her concerns were all the things that normally bother somebody when you reach this particular age. And remember that the aging process, there's sort of a ubiquitous onset which tends to be correlated with the perimenopause and menopause changes and estrogen levels dropping. And suddenly there's an onset of these changes that make a person very unfamiliar to themselves. And that, at the core of it all, is why people undergo facial rejuvenation procedures and seek the things that can help bring back their youthful appearance and really at the end of the day make them look familiar. And as I say before, and I say it again and again, this is really about helping people look as young as they feel, because in the minds of every patient I've ever operated on, and I'm sure you can relate to this, especially if you're in your 40s and 50s and 60s, if you close your eyes and you think about how old you are, you're much younger than your chronological age, somewhere probably within 20 to 30 years sometimes even. So that psychological discordance between the way we feel and our actual age and the way we look, all of that is the overall outcome of these procedures. So how do we get there? And how do we get there naturally? Because remember at the end of the day also that one of the most important aspects of facial rejuvenation is familiarity with yourself, but also looking normal and natural. We've all seen what it looks like when people look different or unusual, and that is not what people sign up for or what they hope to get out of it. They just want to be themselves minus some of the aging changes, right? So how do we get there? My formula for the last 20 years has been, in addition to the individual procedures, which I'll discuss here, it's also about bringing the entire face back up to a level that holistically, comprehensively looks young. And I'll explain this in a moment. When you're aging, every part of your face is aging together. Your eyes, your skin, your jawline, your neck, and I'll go through these step by step with you, but everything is changing together. When you're younger, everything looks young. There's no old parts and new parts mixed together. And so often after surgical procedures, people end up looking like a mix between young features and old features, depending on what individual procedures you've had done. And that is a telltale sign of a face that doesn't look natural and a telltale sign that somebody has had surgical work done. That's not what we want. We want a comprehensive look. So how do I get there? This is the approach that we take, and this is the approach we took with Cheyenne. So first of all, let's look at her before photos. There are three aspects that we are going to evaluate in each situation. We're gonna look at the quality of the skin, where it is on the aging continuum. We're gonna look at the status of the volume. That's number two. And number three, we're gonna look at sagging. The things that sag in a face are typically the eyelids, the upper and lower eyelids. The lip gets a little bit longer, but also the sides of the face where the lateral brow, the mid-face, jawline, and neck all start to sag. Those are things that require surgery. Then there's things that lose volume. Volume loss throughout the face happens upper eyelids, lower eyelids, temples, lips, around the mouth and the chin area. All these areas begin to lose a little bit of volume. That's because of fat loss. And then the skin ages through its basic mechanism of thinning collagen. As you remember from previous videos, we talked about collagen peaking in the mid-20s and then starting to decline, and then really declining quickly as you get into perimenopause and menopause. Thin of the skin, causing lines and wrinkles, discolorations from years of sun exposure, etc. So those are the three categories: skin, volume, and sagging. So now let's look at Cheyenne. Cheyenne at age 49 had the basic general concerns of she's no longer looking as youthful and as beautiful as she felt before. So what are those changes related to? So let's break it down. So let's look at her skin. So as you can see in her skin, overall in very decent shape. She lives up in Washington in the areas where sun exposure is limited compared to Southern California, for example. And overall her skin is in pretty good shape, but there is some sun damage. There are some fine lines and wrinkles. There are some discolorations, both red and brown pigment in her skin. Now let's look at what's happening from the volume point of view. Let's look specifically at the areas of the face where there's volume loss. So if you look here, you can see that there is a loss of volume, sort of concavities as a result of that in areas of the temple, the area above the eyelid, areas underneath the eyelid. There's also loss of volume around the chin in an area we call the pre-jowl sulcus. And then if you look at the lips have deflated a bit as well, and they all kind of look a little bit hollowed. Now, these are the areas where existing fat pads begin to diminish with time. And as a result, Cheyenne, like everyone else, has lost some of that volume. Now, let's look at the areas of the face that have created some sagging around it. Let's start with the eyes. As you can see, the upper eyelid has a little bit of extra skin. The lower eyelid has a little bit of extra skin and fat that is puffing out. So that area is the pseudoherniation of fat that's bulging forward. And then if you really look closely, you can see in the eyelid, there's a distance between the eyelid and the cheek that has elongated, which is a telltale sign of aging as well. And that's because the fat pads around the area along the orbital bone have diminished and the midface and the eyelids have started to drift downward, creating a longer distance between the eyelid and the cheek. This is one of those telltale aging changes that happen to the lower eyelid that makes the eyes look tired. Looking down at the level of her lip, you can see the distance between her nose and the top of the lip has gotten a little bit longer. The youthful distance is typically between 13 and 15 millimeters. In Cheyenne's case, that distance is roughly 20 millimeters. So it's gotten about 4 to 5 millimeters longer than it ideally would be. And that is something that makes the mouth look drawn, it makes the upper lips look thin, and as an overall result, it ages the mouth in combination with a loss of volume. The critical aspect of the aging process that really ages us, that really makes us look older, is a change in the facial shape. If you look at Cheyenne's facial shape overall, she's more square looking. Her lateral brows have come down a bit. The mid-face is crowding down towards the nose and in towards the mouth. So there's a deepening of the nasolabial fold and a little bit of a hollowing down in the center of the mid-face as everything is flowing down. And as a result, the jawline is showing signs of jowling. And then ultimately, you see that in her neck as well. And you can see this and appreciate these changes in multiple views. And when you see this on the front view, you can see that there's an overall more rectangular shape to the face. And when you go to the 3/4 view, you can see that there's the presence of the jowling and the loss of the mid-facial shape. The neck looks loose, the lateral brows have come down, and there's an overall loss of volume. When you look to the profile view, you can really appreciate the loss of the cervical mental angle, which is the angle between the chin and the neck, and all around laxity that you can appreciate and see there as well. Now, seeing all these changes and looking at them directly, afterwards, you come up with basically a plan. So given these changes, each of these areas that we just talked about with the skin, volume, and the areas of sagging all require a specific treatment to address. So what are those treatments? So let's look in Cheyenne's case. So this was a plan that I came up with for her. So for her skin, because her skin wasn't in terrible shape, I basically started her on the KaramMD Trifecta as a skincare routine that she would do at home. She didn't need a laser or any type of chemical peel because her skin wasn't bad enough to require that jump start at the time of the procedure. Just at home, skincare coupled with sun protection is all she would need. With regards to her loss of volume, a fat transfer that is going to address the volume loss in her upper lids, around her eyes, the mouth, and the chin area. What fat transfer is basically is where you take fat from one part of the body, in most cases the outer thighs or the stomach, and inject it into these areas. And because the fat transfer is going from one part of the body to the other, your body accepts it as a graft and accepts it as a permanent part of that tissue. So it's not like a foreign body where your body's trying to break it down like it does with fillers. Here, the fat is literally made home and it creates a new location for it, and it basically becomes a permanent part of that area that has been transferred. That addresses her skin and her volume. Now when it comes to sagging, first step of priority is to bring the jawline, neck, the mid-face, and the lateral brow back up. In my practice, I perform a procedure called the vertical restore, which is a deep plane technique that tilts this entire soft tissue back up into the vertical direction. So it's basically like when you go in the mirror and you're putting your fingers on your cheek here and your neck here and you're kind of going up, you're like, oh yeah, that looks so much more familiar. I look a lot like I used to. That's what you're getting with a vertical restore, but you're taking it all the way up to the lateral brow. So it repositions the entire face and the neck back to where it was. That's a foundational, very, very important part of looking young, is getting that shape right. And if the vector is in the right direction, you're gonna look natural, and that's a really important part of the vertical restore as well. Now when we go down to our central face, we wanna take care of that upper eyelid skin, we wanna take care of those lower eyelids. We're gonna do that with a blepharoplasty, upper and lower blepharoplasty. Then when we go down to our lips, we wanna shorten that distance a little bit, so we're gonna assign a lip lift. Upper lip lift is basically an incision that's made underneath the nose, and a variable amount of skin is removed from the upper lip. That's the distance that's gotten longer, and then the muscles are tightened up, so it shortens the lip. So that becomes Cheyenne's comprehensive facial rejuvenation plan, addressing every aspect at the same time so that the overall result looks balanced, harmonious, and natural. Now let's see if we did it right and if you believe that that is the outcome. Now, I wanna give you a little bit of warning. When you go into the recovery phases of a procedure like this, it's going to be rough, right? So it's a process that we typically talk about being about a 2-week process before you're quote unquote restaurant ready, and we'll have pictures and videos of Cheyenne during these different stages so you can judge for yourself what that looks like. But then note that as time goes on, it just gets better and better and better, and you'll also be able to appreciate her changes a year and a half later when I sit down with her and have a nice talk and we go over all of these things. So without further ado, let's break it down. Let's look at these different stages together and then reconvene at the end. The first stages of recovery from day 1 through roughly 4 or 5, you're gonna have significant swelling. Things are gonna look really out of whack, and that's because the tissues are absorbing a lot of fluid and they're becoming swollen. Once you reach about the 5th day, swelling goes down significantly, and then between week 1 and week 2 is where the majority of the healing takes place, and you can see that here as well. So now let's take a listen and see what Cheyenne has to say at her 2-week mark when she sent me a little follow-up video to see how she's doing.
Hi, Dr. Karam. It's been 2 weeks today since I've had my vertical restore, lip lift, both upper and lower eyes, and I am looking fabulous, but definitely very swollen, still a little hard to move my lips and my face, and definitely get swollen through here a lot, but I look amazing. Wow, I'm looking forward to seeing what happens next. Thank you.
As you can see, everything is really falling into place. She's starting to get that beautiful youthful look again, and she's really feeling great. You can see that in her eyes, the spirit in her energy. It just looks so much more confident and much more overall happy with where she is in the anti-aging process. And we love to see that confidence restored in the post-operative. This is what it means to look as young as you feel. It's that energy that you exude. All right, so now let's sit down and talk to Cheyenne at a 1.5 years out. When she came in, she was in town, happened to be in San Diego, and she stopped by and we just had a nice little chat and had an opportunity to not only review her before and afters, but also have a look at her in person and discuss what this year had been like and how all has been going. All right, so we had a very surprise visit from Cheyenne. You look amazing. You look amazing. We just had a fun moment together. We looked at the before and afters, and it was jaw-dropping, which we'll share in a second here. That's awesome. So talk a little bit about what this post-facial rejuvenation phase has been like for you.
5 days was, uncomfortable, but it was doable. I would do it again tomorrow.
and then how's it been just living in your own skin with the post-rejuvenation? I think for a lot of people, we talk about looking as young as you feel and that type of thing. So where does that sort of all fit in with you?
I love hair and makeup, so putting my makeup on is much nicer. In fact, I don't even have to wear much anymore and then I just get my eyelashes done and I feel like I don't have to It just
done.
Yeah, I just
easy.
put my skincare on and it's
Off we go. Yeah.
Yeah.
So let's take a close look at Cheyenne. Kind of the hallmarks of a youthful face. Let's look this way. Is this V-shaped jawline, smooth neck, no laxity, no puffiness or extra skin around the eyes, good volume transitions between the eyelid and the cheek and the temples, above the eyes. And as you can see, this distance between the nose and the lip is shorter with as a particular level of shortness, so you get that nice youthful mouth. Post vertical restore, post facelift, you want to see the hairline shape is the same. You want to see the overall ears are the same. And in Cheyenne's case, I mean, you would never pick her apart from anyone who's had anything done until you look at the before and afters, which when we're looking at the befores, all those things that we just mentioned, there's laxity along the jawline, laxity at the level of the neck, a longer upper lip, puffiness under the eyes, a little bit of hollows, all the things that basically make somebody look a little bit older. And then when you look at the after photo, I mean, she just looks absolutely stunning and youthful and without any evidence of having any work done, which I just love. And I could not be happier that you decided to pop in and see us, and we're gonna continue checking in together as time goes on. But at this point, basically, it's just sun protection and trifecta and or any other really solid skin program. But you do those things, and you're good in the long run.
I have a question. Do I ever need to come back and do more? Like how many years am I coming back?
It's gonna be a long time.
Time.
Yeah.
Okay.
10-15 years from now at least.
Okay. I'm in. Thank you.
I love it. Thank you. All right, so let's do a fun little before and after evaluation, and let's take a look at how everything looks side by side. So here we can see before surgery and a year and a half afterwards, you can see that Cheyenne looks normal. She looks like a normal human, doesn't look like she's had any work done. In fact, let's take a quick look here. If you just have a look at her after photo and you had no idea what she looked like before, there's no way you would know she's had anything done, and that's what we want. Now, when we look at her on the front view, you can see that the areas that we addressed, the eyelids look so much more refreshed. The distance between her eyelid and her cheek has shortened in the post-operative photographs. Pay careful attention to that as we look at the different views. And you can see the overall facial shape. She's got a much more smooth jawline with the shape of the face that is much more of like an upside down triangle as opposed to what she was before, which was like a long rectangle. Then when you look at her mouth, you can see that the increased volume around her lips and her chin just makes her mouth look better. In addition, and this is a very powerful point, what her distance looks like between her upper lip and her nose. That distance shortening really revitalizes the mouth, and she just looks really pretty, and again, very beautiful without any elements of surgical intervention there. Very natural. Looking at her from the 3/4 view, you can appreciate these changes as well. And now looking at her from her profile view, you can really see the improvement in her overall neck and her soft tissues of her jawline and her lower face, as well as the all-around outcome. Yeah, I could not be more happy with Cheyenne and how she turned out. Again, at the end of the day, it's about the right techniques. Every one of the things that I showed you here are meant to be reversals of the aging process, not fundamentally changing the shape or of the way we look, just to basically rewind aging. That's a special outcome that our procedures provide, and a lot of patients literally from around the world travel for these procedures because of that reproducibility, of that consistent outcome that is natural and youthful and themselves without any evidence of surgery. And I'm so grateful to Cheyenne for sharing so much of this information and so many photos and videos and allowing us to share them with you all. I think it's really important to know what you're getting yourself into, and then also to be able to know what's available. So again, thanks so much for your attention. Thank you so much, Cheyenne, for your generosity with this material. If you haven't already, make sure you subscribe to our channel. If you like this, hit like, comment any questions you have. I'd just love to hear from you in general, as well as share this with some friends and family. Let's get the word out. Let's show what is possible for those who really want to ultimately look as young as they feel. There are some good options available out there. All right, folks, thanks again. Dr. Amir Karam.